Good morning. All right, how many people in this group are pre-deployment? The majority, okay. All right, do we have a clicker up here, ma'am? You got me, okay, thank you very much. I got you, okay. Good morning, everybody. I'm Tony Kennedy with Tricare. I promise you I won't bore you to death with everything about Tricare, but I've got a table out there. We'll be out there all day today, and as long as they let us stay tomorrow. So on the second floor. So please come see us over in the Strand area on the second floor, and we'll help you out with any kind of Tricare issues you may have. Let's go ahead to the next slide, please. Okay, one more. I'm going to be jumping through slides quite a bit here. I apologize. Okay, that map, basically, I'll keep it up there for just a second. That shows the 3 regions of Tricare. I work for Tricare South in the yellow region, Humana. If you happen to have any dependents, the only reason I show this, if you have any dependents that are going to be staying in one of these other regions during the deployment, please change the DEER's address. That is crucial. We cannot service somebody that's living in California in Mississippi or Louisiana. So please update the addresses if you're going to stay anywhere for over 30 days. Even if you're moving within the same region for over 30 days, keep those addresses correct in DEER's, please. Next slide, please. And there's the DEER slide. We'll skip one more. Early eligibility. This is one of the most confusing. I could stand up here 15 minutes and talk just about that, so I won't. But I'll tell you, please come visit me if you have questions on it. But the bottom line, the day that your personnel section, your S1 guys, get not necessarily your orders, but your name and your social on a MOB roster into DEER's, that's the day that your early eligibility starts, up to 180 days before the deployment. Now, luckily, with Army Guard and Air Guard, we usually can get the full 180 days. I see Marine Corps Reserve units that might get 7 days pre-activation benefit. So if you notice on there, it says up to 180 days. That's the key. We can never promise you 180. It depends on when that order, or when your name and social, rather, get put on a contingency mobilization order into DEER's. If you don't know when that date started for you, or if you don't know if it has started, I can provide you with some phone numbers to call and check it out on a Monday through Friday. Very easy to check. You can check in DEER's or you can check with us. But get with us on that, because that's a crucial date, is when that benefit started. Because it not only starts that day for you service members, it starts for any dependent family member in DEER's. Health care starts for both or for all. Dental starts for the service member only. The only way the family member is going to get dental is if you're purchasing it through MetLife. I just throw that in real quick. I'm not the dental guy. We have the United Concordia and MetLife have a table out there close to mine, so you can come see any of us today or tomorrow. Next slide, please. Service members, once your pre-activation benefit starts, you're under managed health care. Basically, Tricare Prime without enrolling in it. You don't even need to enroll, but you're on a thing called direct care only, meaning if you're within 50 miles or whatever the catchment area of a military base, an active duty base, you have to use the base. If you're outside that area, you have to use our network doctors. So basically, you need to call us and get approval and let us make sure you're going to be using a network doctor. What's the one thing that overrides everything I just said? Emergencies. If you got an emergency, get to the nearest emergency room, and I promise you, even as confusing as Tricare is, we'll use common sense on that. We're going to pay for an emergency visit, and just get the approval after the fact. Call us after, as soon as things calm down. Next slide, please. For the family members, and I'm rushing through this to try to cover everything within a 15-minute time, but family members are not forced into managed health care like the service members are. You have a choice as a family member. If you don't do anything else except have once that benefit starts, if your family member's in DEER's correctly, every family member, every eligible family member is on Tricare Standard. Tricare Standard allows you the freedom to go to basically whatever doctors you want to, but you're going to have some out-of-pocket cost shares. It's more like a civilian insurance. You can go to Dr. Jones over here this week, Dr. Smith this week with no referrals. As long as they'll file a claim for you, you're good. It's not, again, it's not managed health care. And if we can go to the next slide, and one more. The thing I didn't know, I served 21 years on active duty with the Guard, and for most of that period I was married. If I had known what I know now, based on where I live, not telling you should do this, but based on where I lived and the availability of Prime and physicians on the network, I would have kept my family on Standard if I knew what I know now. Mainly that next to the bottom line, catastrophic cap of $1,000, Basically, if you put in this hand Tricare Standard and you put $1,000, you're buying your freedom in health care with that $1,000 for a year, for your whole family. That $1,000 is not per person, that's for the whole family. What a catastrophic cap means, for those of you that are not familiar with insurance terms, once you reach $1,000 out of pocket, with those 20% cost shares and 15% you see up there, your pharmacy bills, everything, if it all adds up to $1,000 for the whole family in a fiscal year, we start paying 100%. So basically, Tricare Standard, again, you're buying freedom with up to $1,000, $1,000 maximum. For a family of 4, some families can reach $1,000 out of pocket by Christmas every year on the fiscal year, and then you're going to whatever doctor you want for free. So that's the difference between Standard and Prime, basically. Freedom and free. And we'll talk about Prime in just a minute. I'm not knocking Prime at all. I'm on Prime as a retiree, and I like it. But I'm a single guy now. It doesn't matter to me which doctor I'm having to see necessarily. I don't need that freedom that I would have as a family person. So take a look at it. They're very viable options, both of them for you. Some are going to fit some families. Prime is going to fit some. Standard is going to fit the other. But I will say this, after a deployment, I get more complaints from families who just rushed themselves through the process and said Prime is free without checking into which doctors are available in your area, and just sign up for Prime without thinking about it. That's the ones I usually get complaints about, saying, hey, I didn't like it, I couldn't find a doctor, I didn't like the referral process, this or that. So just be careful. It's a choice you're making. You have to enroll in Prime to have Prime. Next slide, please. Tricare Young Adult, I don't have time to get into all that. If any of you are unfortunately my age and you have kids over 21, and you're needing to consider the Tricare Young Adult purchase for them, come get with me at the table and I'll describe that. But the health care laws haven't affected the basic ages for Tricare. It's still the 21st birthday if they're not a full-time student in college, they're cut off Tricare, 23rd birthday if they are a full-time student in college. The only way to go above and beyond that is by buying the Tricare Young Adult. Next slide, please. Tricare Prime. Again, if you want your family members on Prime during the deployment, you've got to enroll them. Otherwise, they're going to be on Standard. You can do that at any time. It's not an open enrollment. It's a continued open enrollment season. So you can make that choice at any time. I have a few of the forms at my desk or my booth out there. You can do the whole thing online, and it's a very simple process. If you do it by the 20th of any given month, your family will start on Prime or Prime Remote the 1st of the next month. Next slide, please. And let's keep going. Prime basically is free. If you follow the rules, the only thing you'll be paying out of pocket on Prime is the pharmacy copays. And they do go up every year, but they're still reasonable, at least what I consider reasonable. Next slide, please. There are those pharmacy prices. What's the one pharmacy that we can't use, the national brand? Oh, you folks have been through this before. Walgreens, unfortunately, is still not on the Tricare network. Rite Aid, CVS, Winn-Dixie, Target, Rouse's, just about everybody else in the South, every national chain or southern regional chain is still on Tricare. Just be careful. Don't use Walgreens on Tricare. Other thing I'd mention on pharmacy real quick is the home delivery in the middle there. You save a lot of money. You save the government a lot of money. They'll save you money, therefore, on the home delivery. If you have a recurring monthly prescription, let's just use Lipitor, for instance, since that's what I take as an old man for cholesterol. The generic brand of Lipitor, I get the home delivery, 90-day supply sent to my home for absolutely nothing, no cost. Never have to go to a pharmacy. But it has to be a recurring monthly prescription. Can't be something you need once in a while. Next slide, please. Okay, active duty dental program. I hate to cover the dental folks' thunder here, but I don't think they're going to have time to get up here and speak. Basically, again, you're under, as the active duty benefit for once you get on the pre-activation benefit or during the deployment or the 6 months after now, you have free dental through United Concordia, but you have to call the active duty dental line to get a control number. There's a little fold-out card that we have the numbers on, and we actually have the United Concordia guy here with a table. Again, get that phone number, call that number, get a control number. This is service member only now, not family. But for the service member, if you get that control number, they won't even force you to go to a military base, a military dentist. You can go to a civilian dentist, but it's got to be one in their network. If you get a control number, it's totally covered, it's free. Next slide, please. Let's keep going. I'm going to be wrapping up here soon. If your family wants dental, they have to buy it through MetLife, the other dental rep that we have here today. MetLife handles all the family dental during deployment, during reserve status, anytime. Those prices that you see at the top apply only for during the active duty period and the pre-activation period. They don't apply to the 180 days after. So you get a significant discount while on active duty for your family members. Either 1066 for one family member or 3196 for multiple family members. Next slide, please. If you're going to keep any other insurance, this is about the simplest statement I can make here today in this complicated insurance world. If you're going to keep another insurance, Blue Cross, Blue Shield, Aetna, Platinum Cross, Platinum Shield, whatever, I'm making up insurances here, the best or the worst in the world, it doesn't matter. Tricare is going to be secondary for the family members. We're going to be primary for the service member on active duty, no matter what insurance they have, but we're always going to be secondary for the family member. So, all that I said about standard and prime, if you're going to keep another insurance, forget about it. Just stay with standard. Standard works very well as a secondary policy, because that's all we're going to be. If you're keeping another insurance, simply raise your hand every time you're at a doctor, pharmacy, or a clinic, seeing any kind of physician, and just say, I have Tricare as a secondary policy. You don't need a fancy Tricare ID card. You just need your dependent ID, and just keep it that simple. Go to the same doctors you've been going to all your life on your insurance, and just file us as secondary. Just make sure they'll file that secondary claim for you. Next slide, please. Any questions? Thanks for your time.